Good morning, good afternoon, good evening, everyone. We apologize for the little delay. We were trying to solve some of our technical issues here today. We are pleased to start today's session. Before anything, we would like to just give you some technical, and welcome, of course, to all of you who are joining us today for this session. And we would like to, unfortunately, we don't have a live interpretation right now, but we will have our system, Wordly. It's a system that provides interpretation online, as a live streaming. So if you go into the icon of the online live streaming that you have on the top of your screen, and you can, click on that, and Wordly will provide, computer generated translation into any language that you may choose. So what you will see is, the list of languages that you can choose. You can click on that, and you give you a separate screen, and you can arrange to have both screens available to you, so you can see the panelists, and you can also read the translation side by side if that's what you need. If you have any trouble with if you have any trouble with the translation, just put it on the chat, and somebody from our tech side will clarify how to access this this feature of called Wordly. If you want to during the live stream, to be hashtagging us, and that's what we've been using, Ubuntu Symposium. So feel free to let everybody know that you're here with us today at the MenEngage Ubuntu Symposium. So thank you so much for joining us. This is an ongoing program that goes on until the end of June, with a series of sessions. So without much more on this, I will pass on to Mageda, who will be our moderator for today, and will be introducing all the panelists for our session. Mageda, over to you.
Thank you so much, Magali. Thank you so much for this opportunity. My name is Mageda Esolyo. I work with Women Global Network for Reproductive Rights as the Networking and Alliance Building Officer. And I also double up in doing some communication work. We are so thankful for this opportunity to present on our Africa experiences on working with men and boys in advocating for sexual and reproductive health and rights, as a partnership between Women Global Network for Reproductive Rights and MenEngage Africa, and also to have this opportunity to be able to create a space whereby the change makers from MenEngage can be able to highlight some of their work they've been able to carry out in the past year under the project SRHR for All. So thank you so much wherever you're joining in from. And we hope you enjoy your time with us and share your learnings as well. Also, you can just be able to feel free and share in the chat box in case you have any questions. Before I go ahead to call upon the presenters we have today. So we will start with Arya Chibuta, who is the Executive Director for Young Women in Action. And Harriet Chibuta is a young women's rights activist currently serving as the Executive Director for Young Women in Action, a youth-led and youth-focused non-governmental organization in Zambia. She has over 5 years experience in promoting women's rights at community and national levels through advocacy, movement building, and lobbying. She believes that dismantling negative social norms is the key to greater justice, a just society. Thank you so much for being with us, Harriet. We also have, please bear with me. Welcome, Harriet.
Thank you very much, Mageda.
Great. Today we also have with us, bear with me in terms of my pronunciation, Ontla Raleru from MenEngage Botswana, who is the country coordinator, and she's under the program SRHR for all changemakers. If you can just say hi to everyone, Ontla.
Thank you for the introduction and hello to everyone.
Thank you. We also have with us Nondo E.Ejano, who is the African Regional Director for Women Global Network for Reproductive Rights. Nondo, originally from DRC Congo, has an academic background in development studies with specialization in environment and sustainable development. And he has embarked on a journey in feminist movement for over 20 years. He has extensive experience in community, national, cross-national development programs in sub-Saharan Africa. He also has 12 years experiences of managing programs that challenge inequalities, rights abuses experienced by women in their diversities, and promotes access to SRHR, including access to safe abortion and holistic women empowerment in both Anglophone and Francophone African countries. His competencies include program management, resource mobilization. Nondo also has an outstanding oral and written communication skills in French, English, and Swahili. If you can just say hello to everyone, Nondo.
Okay. Hello, everybody. Yes, I'm happy to have you in this room, and I think it's an opportunity for us to learn and share from each other. Thank you.
Thank you for that, Nondo. Our fourth panelist is Amon Mulyowa. Amon joins us from Uganda. Amon is a teacher by profession and a communication specialist by training, and a social worker with over 23 years as a teacher and 15 years of experience in public health, focused in social and behavior change communications and promotion of capacity building for 12 years in research. Amon is equally good at message developing and has led message developments for organizations locally and internationally, latest being the Women Global Network for Reproductive Rights, and supporting in the development of the communication strategy to address masculinities that stop men and boys from supporting women and girls to access safe abortion services in sub-Saharan Africa. Amon's other employers include Accessible Health Communication, Education PACE, John Hopkins School for Public Health, amongst others. Thank you so much. Welcome, Amon. If you can just say a word to everyone. Hello, Amon.
Thank you so much, Mageda, and everyone for inviting me. I can say I'm itching to get going.
Great. Thank you. Thank you so much for that, Amon. So today we'll just be talking about the Africa experience. And without further ado, I would just like to welcome Nondo E.Ejano, who will take us through why do we have a partnership between Women Global Network for Reproductive Rights and the Changemakers and in MenEngage Africa. How did this come about? We would really like to hear about this partnership and this journey. Welcome, Nondo.
Thank you very much, Mageda. As I've already mentioned it, my name is Nondo E.Ejano. I work for Women's Global Network for Reproductive Rights as the regional coordinator. I will ask Magali to just put on my presentation. Today I'll be talking about the partnership between WGNRR Africa and MenEngage Alliance. And the partnership consists on working with MenEngage changemakers around involving men and boys for SRHR for all in Africa. And yeah, I think this is the reason why I titled my presentation as Power of Partnership, working with change makers for all, for SRHR for all in Africa. Next slide, please. Yes, in this presentation, I'll be providing a brief overview of WGNRR Africa. I will also talk about the rationale of WGNRR and MenEngage partnership. I will talk about what was the specific role of WGNRR Africa in this partnership, and we'll share some of the key achievements together, and challenges, as well as lessons learned. Next slide, please. Yes, who we are. Women's Global Network for Reproductive Rights Africa evolved from WGNRR Global, and it evolved as an expression of its African constituency for an autonomous and stronger coordination of actions in advancing women's reproductive rights in Africa, in an African context and perspective. So we are a grassroots-led regional network that connects and strengthens movement for SRHR and justice in Africa. We are a network that strives to ensure sexual and reproductive health and rights are protected and fulfilled as universal and indivisible human rights for all people. Next slide, please. Sorry. Yes, our vision is an Africa where all people can fulfill their sexual and reproductive rights. And our mission is to connect and strengthen for SRHR, to strengthen movement for SRHR and justice. Our work is grounded in the reality of those who most lack economic, social, and political power. Through critical analysis and strategic actions, we always connect members and allies. We build knowledge, we organize campaigns, and share resources. And I think it's based on this kind of analysis and the movement strengthening, which brought us together with MenEngage to work together under this SRHR for All project. Next slide, please. Why partnering with MenEngage, or why this partnership between us? We all know that the harmful social norms related to masculinity and patriarchy system consolidate men and boys' unwillingness to recognize women's sexuality and bodily autonomy, and act as drivers of discrimination, stigma, and violence towards women, girls, and people of diverse gender identities. And this inhibits the realization of full sexual and reproductive rights for all. MenEngage Alliance has identified SRHR as a priority strategic area to understand the overlaps and intersections between gender equality and SRHR. Together, we realize that involving men and boys in supporting women's SRHR will contribute to the reshaping of masculinities and to full gender equality. And this is just because we strongly believe that working in partnership creates conditions for information sharing, skill sharing between our organizations and our constituency, and building each other capacity on our area of expertise. MenEngage is expert in engaging men for gender equality, and WGNRR is expert in advocating for SRHR for all. So we thought we would put together this expertise and work with our audiences to ensure that men and boys are involved in supporting women's right to access SRH services and information, including access to safe abortion. We also realized that this partnership would also play a role in creating and proposing gender equity measures and narratives that are related to gender identity, gender stereotypes, health and well-being, and particularly the SRHR for all people. Next slide, please. Yes, what was the specific role of WGNRR in this partnership? The aim of the partnership was to strengthen collaboration in overlapping fields of SRHR and gender, and enhance the ability of WGN and the MenEngage members or change makers to mobilize communities by involving men and boys to challenge the harmful social norms that undermine the fulfillment of SRHR for all and gender equality. In that perspective, WGNR specific role consisted of mobilizing the MenEngage change makers to actively participate in May 28 campaign and September 28. These campaigns are global campaigns that are very, okay, I would say that are very well known, and more information for the campaign can be found at www.may28.org and www.september28.org. Yes, I think both these campaigns provide an opportunity to the large community mobilization, for a large community mobilization around SRHR for women. But specifically, May 28 is an International Day of Action for Women's Health generally, but September 28 is Safe Abortion Day. So we found like these two campaigns would provide many change makers an opportunity to take specific actions in their community to try to mobilize men and boys to support SRHR of women. Our other role consisted of working with change makers to develop a messaging framework and advocacy tools for women's right to safe abortion. And I think this had a very good turnover, because we really came up with a specific and tangible result, which maybe I'll talk about that in my next slide. So next slide, Magali. Sorry. Yes. What was achieved so far? We organized a May 28 webinar with change makers and many other actors from the large WGNRR audience, and the aim of the webinar was to mobilize and encourage MenEngage change makers to take specific actions supporting SRHR of women amidst COVID-19. And this should be also should use the approach of involving men and boys. We all know that the world is really grappling with the COVID pandemic, and most of the resources are being shifted to COVID, undermining SRHR issues. So women are being the most marginalized in this crisis. So the May 28 webinar was around calling upon government and different stakeholders, including men and boys, to support women's SRHR during this pandemic time. Next slide, please. This is why you will see yeah, I think that's what it is. We also developed some campaign materials in consultation with the large WGNRR constituency and the number of MenEngage change makers. And this campaign material included the call for action, some infographics, and also we had some very key messages calling for support to women and girls SRHR during the pandemic. Some of the key messages include the provision of SRHR services, including safe abortion and gender-based violence services, is central to ensuring the health, rights, and well-being of women and girls. Yes, those are some few messages among so many which we developed during that campaign. We also engaged the change makers to jointly co-create a social behavior change communication strategy with some key messages to different segment of the society, including men and boys. I think Amon will have a detailed presentation on this process of developing the SBCC strategy. So I don't really, I don't want to spend more time, talking about that. Next slide, please. A number of communication material with key messages that can be also adapted to country-specific context were also developed under that process, and were used or are yet to be used by the change makers and the large WGNRR audience, WGNRR Africa audience. I think this is a very comprehensive tool that can really be used by different audience for different audiences, but by different actors, not only the change makers, the African change makers, but also some other change makers of MenEngage all over the world can still use those materials and adapt them into their context, and also try to translate some of those materials in their local languages for large dissemination. Yeah. For example, you can see a message there saying, saying safe abortion must be provided, supported by a trained person using, yes, all this. We have a lot of messages. Yes, go to the next slide, please. Yes, some of the messages are, worry not. When a woman is able to access safe abortion services, the number of abortions that are unsafe decrease. Support a woman's access safe abortion services. It saves. Yeah, and so many other messages. I think the document is large, and it contains a lot of messages targeting different audiences. Next slide, please. Yeah, let me talk about some few challenges we went through, and I would say what some few key challenges. I would say that our key challenges was COVID-19. We all know that COVID created uncertainty among both staff and communities. The shift from the offline to the online working model has made the time management and actual mobilization work very hard for not only us, but also for the change makers and for the community itself. Reaching community online was very challenging, as access to internet is yet a headache in so many communities in Africa. And also the safety of the staff, the change makers, and their audiences was of concern, causing that kind of trauma and mental fatigue. Next slide, please. Yes, some of the lessons learned include, yes, we realize that men and boys engagement should not only end up at community level, but it should go up to the very high policy level, as most of the duty bearers, policy makers and people who sign policies are men. So involving them in this kind of discussion would enlighten them to know why it's important, to support women's access to SRHR, including access to safe abortion. The other lesson is like sexual and reproductive health and right is not only a women issue, it's a community issue. Stigma created around it affects all of us. Thus, holistic engagement of all society actors, including men and boys, is crucial to ensure full SRHR and gender equality. And lastly, we also learned that language is an important aspect of the social behavioral change communication and the advocacy work. And not all solutions fit the different target audience and different contexts. Yeah, I think those were the few issues we worked on, and those were the few lessons, the lessons learned during this process. Thank you very much. Next slide. I think that's the final. The final. Thank you so much for your listening.
Uh, Thank you so much for that presentation, Nondo. I think the presentation was very heavily packed with work around why is it important to engage men and boys in advocating for sexual and reproductive health and rights for all. Also seeing a particular focus in terms of access to safe and legal abortion. So if you do have any questions on Nondo's presentation or on the methodology around that partnership, how that partnership started, feel free to put your questions in the chat box, and we will address the questions when we come to the Q&A session. But for now, I would like to hand over to Amon Mulyowa, who's joining us in from Uganda, who then came in afterwards to have this process of bringing together the Changemakers and bringing together Women Global Network in terms of having a conversation around we want to engage men and boys in this work. We want them to be able to talk about access to safe and legal abortion and a particular focus on SRHR in general. How do we go about this? What do we need to do? And that was his particular task when we were doing this work. So I will hand over to Amon, who will be able to take us through really how this went about with the Changemakers and what came out from it. Welcome, Amon.
All right, thank you so much, and I'm delighted to be here. Can I request for my presentation? My name is Amon Mulyowa from Uganda, and is someone helping me out with the presentation, please? To screen share it. And basically, we were brought on board by WGNRR to supporting the development of the social behavior change communication strategy. And I worked on this with a colleague of mine called Ibrahim Batambuze. Ibrahim Batambuze works with the Reach Your Hand Uganda as in charge of multimedia. And so we worked on this, and here, finally, we got the document. So basically, that's who I am. I've done a lot of work around social behavior change communication and health. So give me the next slide, please. So in my presentation, I will look at the consultants whom I told you, who I've already talked to you about, the purpose of this consultancy that we took on, what the problem that the SBCC strategy was aimed at addressing, the different consultancy stages, the different deliverables that were required to share, and then we'll get into whose SBCC strategy this is, the theory of change that we envisaged or we worked around in the development of the strategy, the strategy development process, the different audiences, the messaging, and then something small about the monitoring and evaluation. Give me the next slide, please. So as we said, my name is Amon Mulyowa. I worked on this assignment with another colleague of mine called Ibrahim Batambuze. And yeah, basically that is that for me. Give me the next slide. Okay, so Bata and I worked on this consultancy, and the purpose of this was basically to develop an SBCC, social behavior change communication strategy, for partner members that addresses masculinities and social norms that affect negatively or hinder women and girls' access to safe abortion, comprehensive contraceptives, and comprehensive sexuality education. That was one of the things we're supposed to do, the strategy as a whole document, and then also look through and develop or redesign available and appropriate gender transformative online advocacy and communication materials that promote the role of men and boys in advancing sexual and reproductive health for all. Give me the next slide. So you find that while we were working, of course, a number of meetings were held, lit reviews were done, but we were like asking ourselves, what is the problem? And as Nondo has always alluded to, we realized that the core problem, or the problem, the gist of the issue, I've always used the word that if it was Christianity, who was the Jesus Christ that we needed to sacrifice? In this particular case, the core problem was that the men and boys were not meaningfully engaged, and mark the word meaningfully engaged in supporting women and girls to access safe abortion services. And there was also along the way a realization of stigma and discrimination that was heavily attached to abortion. And this is something that realized that what is the reason the men and boys are not engaged? And the reason they are not engaged is because of the stigma and discrimination that is attached to anything that is associated with abortion. And then the lack of comprehensive information on safe abortion. That most of the information the men and boys were relying on were actually either lies, hearsay, things that are not backed up by research, things that were not the fact. So we went ahead and established that of these, what are the affected populations? Which population is most affected? And you realize that it's actually young women and girls, whom we called women of reproductive age, 15-49 years, all over Africa, with the rural areas disproportionately affected by the problem. The health problem that we needed to address was maternal mortality and morbidity due to unsafe abortion, leading us to that dream, the vision that all of us were looking at, seeing after all our interventions had succeeded or have succeeded. And we say all of us were looking at an Africa where men and boys support women and girls to access contraceptives and safe abortion services. I would say I'll want to be there to see this dream come to fruition. So, how did we go about this exercise, as we say? It's a simple consultancy flow plan. And basically, we had reception meetings with the WGNRR and MenEngage officials. We had a deep speaker analysis, a formative research. We had a development workshop. We had pre-testing and validation and approvals. That's what I'll be explaining in the next slide. Let's go ahead. Okay. So, I think that one will come. So, what is happening is on this consultancy flow plan, I'd already talked about this one, but just to remind us that what were we supposed to come up with? And one of the things was a social behavior change communication strategy at the end of it all, and then an advocacy and communication materials such as infographics, posters, social media posters, fact sheets, and webinar modules, among others. Give me the next slide. Now, whose strategy is this that we develop? Whose strategy is this? What will the strategy lead to? So we realized along the way that this is our strategy. And when I talk about our strategy, I'm looking at WGNRR partners, MenEngage Changemakers, and other like-minded civil society organizations, individuals and government officials working on provision of SRHR services, and those advocating for women and girls' access to safe abortion services. Now, what will the strategy lead to after we have successfully implemented it? It will lead to addressing attitudes, beliefs, and norms, and ultimately practices of the priority audience, and highlight communication avenues and key messages for each of the audiences. So in the strategy, you'll find this addressing attitudes, beliefs, the messages, norms, and the practices of the priority audience, finally leading us to the messages that we developed and people have been using or are yet to be used. Give me the next slide. Okay, so our theory of change was basically a simple one. And the theory of change was basically looking at for the individual to change. I don't know whether you people have seen the inside of an onion or a cabbage. An onion has layers in it. And we're looking at for the individual to change. In this particular case, individual is the man who is not supporting the men, the women and girls to access the safe abortion services. For them to change, they need the second layer around them, the families to change, they need the community to change, and they need the social structures to support them change. So this is basically what we're looking at. And it's something that we felt could be used to overcome barriers to normative and social change. Barriers to the norms, barriers to the societal norms, barriers to everything as in the work that we do. Okay, let's go. Give me the next slide. All right. Next slide. So, what was the strategy development? No, the next one. What was the strategy development process like? As I'd earlier said, when we talked about those different circles, that I'll be explaining this as we move further. Now, we went through different stages of developing this. And with this, we used, we based our development process on what we call the human-centered design. The human-centered design of developing communication programs basically hinges its basis on the issue that if you want to change behavior of someone, then you must basically work with the person to find the solution. You work with the person to find the solution, and the different stages that we went through on this is that one is what we call empathizing, focused on participatory action research, not just the user, but in the brainstorming, modeling, and the prototyping as well. So after empathizing, put issues in the feet of the men and boys to identify why are they doing this. We embarked on defining the problem by focusing on key action we want to achieve. This led us to the next stage, which we called ideating, which was an online co-creation workshop, which was conducted where ideas were shared. The goal was to come up with as many ideas as possible. And finally, we developed archetypes. Archetypes are basically looking at if it is a boy and a girl, can you imagine a boy in your village in Zambia? Can you imagine a boy in your village in Botswana, whom we can mirror? And this is the boy we're having our communication around. And then finally, we had to test what we had come up with. Give me the next slide. So this one can be broken down in the next slide through the different stages that we had. The brainstorm. The brainstorm was basically a meeting with the WGNRR and the MenEngage staff. Take me back, please, the previous slide. The brainstorm with WGNRR staff to agree on the deliverables, to agree on the terms of reference, to agree on the timelines, to agree on a number of things. Now, after that, a situation analysis was conducted, which was a deep stick research or review of already existing materials, documentations that could help us in putting together the strategy. That one led us to what I earlier talked about as the co-creation. And in the co-creation workshop, we had this for about 7 days. We had planned for 4 days, but it took us about 7 days, where we took people through looking through the situation. What is the problem? Why the problem exists? What we need to do? Whom we need to focus on? Why must we focus on them? What do we need to tell them in our messages? Who influences them? What are the different channels and all that? And then what is the M&E plan for it? So after the co-creation workshop, we got down as consultants to put together the document. We put down the document, which was shared with partners for feedback and then shared at a validation meeting. Next slide. So who are our audiences? What did we come up with as our audiences? Now remember, these are not Amon audiences. These are not Bata audiences. They're not Mageda. They are not Nyambura. They are not Nondos. They are not whoever's audiences. These are audiences that the people who were engaged in the thinking process came up with as the audiences which we need or whom we need to prioritize in order for us to get the vision that we're thinking about. So the priority audience, the people whom we needed to focus on were men and boys. But we realized that for the men to change, remember our idea of the onion with the layers, the cabbage with the layers. If the boys and men were the inner layer, they had other layers. And one of the layers were the influencers, the religious leaders. We realized that religion in Africa is big and influences our ideas, our values. The other were the cultural leaders. And I remember a friend of mine in Uganda called Hassan talking about family chiefs, the aunties, who have a great role on what we do as humans. Policymakers, they could be parliamentarians, government, political leaders, and the media. Because once the media has said it, once the media has okayed it, people will always go by it. Next slide. So after identifying our audiences, we went down and segmented the audiences. And we said that audience segmentation basically enables programs to match audiences with the messages, with the media, with the tactics, with the services, based on specific needs and preferences of the audience. And we said that tailoring an SBCC strategy to the characteristics, needs, and values of important audience segments improves the chances of desired behavior change. So with the segmentation, the idea is, I've just been doing a similar session from 8 to 4 in Kampala. And I told them that segmentation will allow you to look through, for lack of a better English word, to look through a person and like, who is this person? What are their aspirations? What do they look out to be? What are the challenges of them getting there? How can we help them get there? The idea is basically to get to understand this person and then develop avenues of getting to them. Next slide. So with the messaging, I'll not go in details of the messages because each of the audiences that we put there, we did the segmentation and good practice that had been elsewhere. And we landed on something from IPPF. And this one is called the golden rule. These goals of message, developing our messages, we made sure that our messages are honest, that they are very honest and accurate. So if they are honest and accurate, the issue about abortion messaging is it's not about you saying what you want to say, but it's about you saying what is accurate. Give the people accurate information, because realize that during the segmentation, the men and boys were at the behavior change stage of awareness. They lacked knowledge, they lacked information, so they needed accurate information. The other one was that our messages are non-judgmental. Non-judgmental, because we believe that every abortion happens in a different situation. So you don't need to judge one over the other. The other one that we focused on was that we focused on the individual, and they said that it is important to maintain a focus on the health and rights of the pregnant woman in all messaging. Not people are saying it's the woman, it's the individual. We also recognize the
Yes, Mageda? Hello? Sorry about that. I'm using my phone for a number of things. So basically, I don't know if I'm still on, but I'm about to finish. The other thing was, in our messaging, we talked about avoid stigmatizing language and images, involve the intended audience as much as possible, always provide references to all our messaging. I think I have 2 slides left, and this one will be done. Okay, the next slide. Okay, so for every SBCC strategy to be complete, you must put in place how you're going to monitor and evaluate the output of the strategy. So we put in the strategy a monitoring framework, and this one is basically going to be used to implement at implementation level, at results monitoring level, and at learning level. And at each of those learning, we will be documenting the lessons learned, the results, will be documenting what came out of it. At implementation level, we focus on tracking the activities that were conducted along the way. Next slide. Next slide. So some of the project evaluation activities we talked about included quarterly monitoring visits, baseline, midterm, and end-term evaluation activities. And these ones can be accessed basically in the document if you ever get your hands on it. Next slide. Yes, this is what I was talking about basically, that the timing of evaluations, we had talked about baseline assessment, we had talked about midterm assessment, and we had talked about end of project evaluations assessments. Next slide. So thank you so much. And that's basically what I had for us. Over to you, my host.
Thank you for that detailed presentation, Amon. I think there's a lot of information about the process of working and how MenEngage Changemakers and WGNRR managed to work on developing a SPCC strategy last year under the SRHR program for all. So just with the flow of things, now we are moving on to Zambia, where we will have Harriet Chibuta, who's a change maker. We know that the change makers have been working on SRHR for all, but now we would like to hear from them in terms of how they've been working on SRHR, engaging men and boys at country level, and also if they have any key learnings from the SPCC strategy, because some of these tips and ways of working that were in the strategy and that are in the strategy currently are tips that they have been using at ground level with their work. So we just want to hear some of their experiences and how this has been going on in terms of their country level work, and also with the challenges we know of 2020 and COVID-19. The floor is yours, Harriet.
So sorry about that. I'm using two gadgets, my phone and laptop, and my laptop has a mic problem. Apologies for that. But my name is Arya Chibuta. As Mageda has introduced me, I'm the Executive Director of Young Women in Action, and I'm here to present what MenEngage Zambia member organizations have been able to do with regards to SRHR in the country. The member organizations in Zambia under MenEngage that work on SRHR include Nyali Zambia, Volunteers Welfare for Community-Based Care, Young Women in Action, Young Women Christian Association, and the Zambia National Women's Lobby. And for us to just undertake the sexual reproductive health and rights, we undertook various interventions, which included advocacy on available laws that speak on SRHR, as well as termination of pregnancies, raising awareness on SRHR, specifically looking at social and cultural norms and how they perpetuate gender-based violence, and also just hinder young women from enjoying their sexual reproductive health and rights. We also targeted some schools, gay community gatekeepers such as religious and traditional leaders who are the custodians of the social norms that we were working on. And lastly, just working on the East and Southern Africa commitments on SRHR. And our main target group included young men and women aged 15 to 35, religious and traditional leaders, parents, because we understand that parents also do have a role to play, tertiary school management, and the general public. So the first activity that was implemented, that was last year, included an awareness raising on the available laws and policies in Zambia. So we had a workshop with young men and women, as well as some representatives from tertiary institutions from the management, to just look at the Gender Equity and Equality Act on its with regards to its provisions on sexual reproductive health and rights. And we also looked at the Termination of Pregnancy Act. The reason we actually decided to go into raising awareness on the available laws and policies is because we understood that we got to learn that the majority of the people do not actually know that abortion, for instance, is legal in Zambia. What is known is that it's just illegal. Although we understand that our law is quite restrictive with regards to abortion, but then definitely it does give room, and it has guidelines on who can access the abortion services. And then we also embarked on a number of dialogue sessions. I indicated that we targeted religious and traditional leaders, and these were mainly to look at the social and cultural norms. This is basically because abortion in Zambia has been, has stigma around it, and it's a social and cultural issue. Zambia being a Christian nation, and what carries, if you're a Christian nation, then definitely you consider abortion as killing. So it has all these negative connotations or stigma that is tied to it. So we embarked on dialogue sessions with religious and traditional leaders to just talk about the negative social norms and cultural norms that actually hinder young women from enjoying the SRHR, as well as accessing some services. We did not just end on dialoguing with religious and traditional leaders. We also went on the ground in tertiary institutions where the young women are found, because Young Women in Action, for instance, focuses on empowering young women. So our work really focuses, our target generally is young women 15 to 35. So went into tertiary institutions to just raise awareness on sexual reproductive health and rights, and also continue talking about social norms. We understand that tertiary institutions also have, their set of social norms, and the students also come to school with various cultural norms because they come from different backgrounds. So we had dialogue sessions with young women, some men, and also school management. And in the picture there, you can see that there was actually young men involved because we believe in working with men and boys, and that is the reason we're actually part of MenEngage Zambia. Then another intervention we took is use of IEC materials, and this is so the IEC materials are in pictorial form, telling a story, right? So you can see in the picture that there's this big poster, so it tells a story of not breaking the silence, for instance, and there were a number of different stories on SRHR and just gender-based violence generally that we did produce and use whenever we were conducting sexual reproductive health dialogue sessions with all our target groups. And we also, Voaza here in Zambia also took it to the men generally, the men and the boys, with the use of sports. So MenEngage Zambia member organizations also get to use sports to just sensitize to the men, to the young boys, on importance of supporting women and also just being champions of sexual reproductive health and rights, and breaking the stigma. So that is what is happening in the picture there after a soccer match, or in between during the halftime. There's a session when members of MenEngage or the implementing organization just sits down with the men and the boys to just talk about SRHR issues. And we also had mentorship sessions, generally around social norms and GBV, and these were for men and boys. So there were different sessions that were held. So there were sessions for men, for young men, and then there were also sessions for parents. So these were in different cycles, and was, mentorship is not a one-off activity. So different sessions were held, and the dialogues really did dive deep into sexual reproductive health rights and just breaking stigma, and also doing away with negative social norms that perpetuate women from actually enjoying their sexual reproductive health rights. And also you can see in the picture there, more dialogue sessions with girls and boys. We believe in dialoguing because, the more you talk about it, the more you raise awareness on the sexual reproductive health rights that young men and young women actually have to both sexes, then we will, to a large extent, break the barriers and be able to to see young women enjoying their sexual reproductive health rights. So there's a picture where a young lady is talking to her fellow young people on sexual reproductive health and rights, and also comprehensive sexuality education, also another component, as well as guidance and counseling services, because these are very sensitive topics, especially in the Zambian setup. When you talk of abortion, everybody will just turn heads and look at you in a very interesting manner. So it's we found dialogue sessions to be very a very interesting and effective way to just break barriers and norms and stigma around abortion. Lastly, we also embarked on call-in radio programs to just reach out to the larger masses, because during the dialogue sessions, the workshops on policies and laws would only reach certain numbers of people, but then we took it to the radio and people would actually call in. It was very interactive, and people would just throw in the negative social norms that they know, and actually do testify that these are negative and there's need to do away with them. So the call-in radio programs actually did show to us that people are actually willing to do away with these negative social norms and are willing to learn more about sexual reproductive health generally, and how we can actually support women on this journey. And for 2021, so far we have planned to have social media advocacy, some town hall meetings where youths will actually lead the sessions and speak with parents and the communities generally, and specifically with the Ward Development Committee members, because these are the people that are right on the ground and speak and influence behavior in communities. So we felt that it would be important to also just get the young people, the young men, join hands and go and speak with community leaders and the general public. And of course, IEC material production does not stop, so we shall continue and more engagements with community gatekeepers such as the religious and traditional leaders, because they're very key and also raising awareness on sexual reproductive health and rights. So generally, the successes have been that religious and traditional leaders have been very welcoming to the interventions, and have indicated and shown evidence actually that they've started talking about sexual reproductive health and rights during their various meetings, sexual gender-based violence, to just try and do away with the negative social norms that perpetuate or prevent women from enjoying their access to different sexual reproductive health services. And engaging men and boys, another success was that knowledge was enhanced. We noticed that during the dialogue sessions, most of the young men and the boys did not know about sexual reproductive health rights, and they came with them with the different social norms that are very, very retrogressive. So a lot of knowledge was gained, and they actually expressed interest in learning more, so we will be engaging them. And through the radio program, we were able to reach over 2 million people, and a good number did call in, especially that we had different men from the religious perspective, from the traditional perspective, from school management, and the general public. So it was very interactive, and I think these were some of the successes. Then the challenges, the first one, of course, is COVID, because of COVID, we could not continue with most of our awareness raising, our person-to-person awareness raising campaigns. But then we have now learned how to work around it. But of course, inadequate resources never misses on challenges. And some people from the dialogue sessions, we could see that some people still hold on to these social norms, the negative social norms that we've been socialized and grown up with. And I think this is not a surprise, because socialization and just changing of beliefs and behavior is not something you can do overnight. But we believe that over in the long run, we'll be able to move forward, and everybody will be on board and supporting women and their access to sexual reproductive health services. That's about it. Thank you very much.
Thank you so much, Harriet, for that enormous presentation. I don't think all the work you've been able to do can just fit in those few slides, but from the conversations, clearly that you have been able to really have difficult conversations at community level, especially we all know about the stigma that comes around with having conversations around safe abortion, sexual and reproductive health, and also looking for creative and innovative ways to bring in men and boys into the conversation in terms of sports, and also working with other partner organizations which actually have that focus. And also just getting a lot of key learnings. And I see in the chat box some questions coming in. Just to say to the presenters that we'll address these questions once we're done with the presentation from all our panelists, but just seeing that there is definitely that connection between SRHR and working with men and boys, because as we said, this is an issue that affects the community at large. And so how do we figure out innovative ways to of doing this and introducing these conversations? That's why we're gathered here. And on to my next presenter. Without taking much time, I would like to welcome Ontla, who's joining in from Botswana, who would also share the work that the Changemakers have been able to do in terms of engaging men and boys on access to sexual and reproductive health and rights, and how to be allies to ensure that girls and women can be able to access these services, and how they are able to create these spaces whereby these very difficult conversations can happen. So welcome, Ontla.
Thank you very much, Mageda, and thank you to the other panelists for great presentations. Were you able to get my presentation from Hassan?
No, Ontla, I don't have yours. Do you, Mageda? I don't have Ontla's. I only received Harriet's.
Okay.
Then maybe you can tell us with your words what you were planning to present.
Okay, so I was also going to present on what we have been able to do in terms of SRH in Botswana, what challenges we have encountered, and which milestone we're able to reach. So it's also going to follow a similar structure to Harriet's. So I guess I can just share it after this session.
Sure. Do you feel like you are in a position to share your screen, or you just want to continue?
Thank you so much. So I just wanted to give a background information on what the state is as far as Botswana is concerned when it comes to safe abortion. So at the moment, abortion is illegal in the country. It's only legal if it will save the woman's life, if the woman's pregnancy gravely endangers her physical or mental health, or if it is a result of rape or incest. And with the last two, that means that the victim of the rape or the incest has to go through other service providers, such as the police, where there has to be reports written and cases open to really show that there's a case of rape and incest. So you can imagine what kind of a cumbersome process that is for the victim or the survivor in that instance. So in 2019, there was a glimmer of hope in that there were reports in our local media that there's going to be a national referendum that's going to find out whether the public would be happy if abortion was legalized on any other condition. And that unfortunately disappeared into thin air it did not materialize. So as NGOs that are working around the issues of SRH and access to safe abortion and human rights in general, we are trying our best to advocate for abortion to be legal in the country. So in terms of the status right now, there are still unsafe abortions happening in the country because of the fact that it is illegal. You'd find that there are a lot of unwanted pregnancies, and so mostly young women tend to resort to unsafe abortions. And reports, anecdotal reports from the maternity wards and also the female wards in hospitals show that they have a lot of women coming in with septic pregnancies, which are results of those unsuccessful attempts to terminate the pregnancies. So with COVID-19, which hit us in 2020, that went on to put strain on the available resources in the medical fraternity. So that means that a lot of focus was then shifted to responding to the pandemic, and as a result, access to sexual and reproductive health services was limited, especially on the side of young women and girls. And in terms of the milestones that we have had so far, we were able to implement a comprehensive sexuality education project in an area called Khanti. So we discovered that this area had a lot of teenage pregnancies, and upon closer investigation, we noticed that there were issues such as intergenerational relationships, where we find that these young girls are unable, obviously, to negotiate for safer sex. And so we implemented this project with the aim of ensuring that we try and engage men in staying away from relationships with younger girls. And we also wanted to engage the communities, because what we noticed is that some communities have normalized such harmful practices, and we wanted to rally communities and community gatekeepers to be a part of the solution to this and not normalize these kind of relationships which end up in pregnancies. And another thing we were able to do, we had a community drama also on comprehensive sexuality education, because what we noticed is that edutainment is also effective in terms of relaying the messages that we want to relay. And what we did, which we feel was a strategic move, was to have it being played on a national radio station so that the reach can be higher, instead of going to private or commercial radio stations, which are usually secluded to certain districts or constituencies within the country. And then the other thing that we did, we were able to attend the joint World Health Organization and UNFPA virtual training on integrating violence against women into SRHR health services. So this training was attended by 3 of the members of MenEngage Botswana, being Men and Boys for Gender Equality, Women Against Rape, and Botswana GBV Prevention and Support Center. So through that participation in the training, we're going to develop a country roadmap that will define the key milestones in strengthening the integration of violence against women into SRH services. So right now we're still drafting it. We're collaborating with, and then the other thing that we did with collaboration with the UNAIDS agency here in Botswana, we noticed that our strategy, our male engagement strategy in the HIV response was outdated. So the UNAIDS contracted us to develop a strategy. So what we have done so far, we've been able to carry out focus group discussions throughout the country with different men to really understand issues around health-seeking behavior, to understand issues or interacting issues such as violence and how we can engage men in the response to HIV, and in turn have them protect their partners, as we know that usually it's the women who are hardest hit by such issues, such as the infections, such as gender-based violence. So that strategy is at a stage where we're just waiting for the monitoring and evaluation plan to be finalized, and hopefully we'll be able to roll it out in the next few months. Now, the challenges that we encountered, as already mentioned, is that as access to SRH services was greatly impacted by the pandemic, and women were the ones who really were affected a lot. That means that some of them weren't able to get family planning, they were unable to get contraceptives, issues such as, the regular testing. Those were put on the back burner, and also with the national lockdowns with no movement, they were not deemed as essential services. And the other challenges that we encounter as we try and promote SRH, we still have cultural perceptions which treat sexual related issues as secret issues. And so it prevents honest dialogue around SRH. And we've noticed that when there isn't dialogue at a family level, at a community level, that's when also young people are prone to experimenting, are prone to risky sexual behavior. So we are trying to go around that by engaging community gatekeepers, such as traditional leaders. We have been offered audience by a structure called the House of Chiefs, which is a forum for all the chiefs of the tribes in the country. So we have been able to relay such observations and such concerns, and they've pledged their support for when we come to their communities. And then we still have cultural practices in some pockets of the country, such as child marriages. In fact, just yesterday, one of the councillors was quoted proudly saying that his wife was young when they got married. And these are issues that we're still grappling with, that some leaders and some cultural practices still do child marriages. And we are trying here to go for policymakers. We're trying to also collaborate with other strategic partners such as UNICEF to see how we can go about such issues. And then we still have gender-based violence happening in the country. It was worsened by the national lockdowns due to the pandemic. And we know that where GBV is, there will be sexual violence as well. And we know that sexual violence can lead to unwanted pregnancies. So we see that GBV still affects our ability to promote access to sexual reproductive health services. And we also have issue of limited funding, because we're saying if we're still having some pockets within the country doing certain practices that are harmful towards young women and girls, that means that we really need to cover the length and breadth of the country. However, that is impossible because of limited funding. So that's about it from us from Botswana. Thank you so much for the opportunity.
No, thank you so much, Ontla, for taking time to share with us your amazing work and initiatives and effort around addressing access to safe and legal abortion in Botswana. Very interesting conversations in terms of lack of knowledge around, around the policies that are there in place, and also just very interesting to see how COVID-19 and increase in violence has been affecting young girls and women in Botswana, and which might actually have an increase on lack of access to safe and legal abortion. Just to say that I think learning from the Changemakers, just seeing the breadth of their work and the extensiveness, really trying to also see if we had the possibility to have all the change makers in this session. I don't think we'd be able to even fit this within 2 hours. But I think many a times as activists, people do great work, but you don't take an opportunity to pat yourself on the back for all the strides that you're taking, especially, for example, talking to the religious leaders and really bringing this very challenging conversations to them. So we acknowledge you and with that work. So there are questions in the chat box, but for us just to round up the panelists in terms of all their presentation, and we will go back in order and start maybe with Ontla, just with the final question, which is on what would you say is the importance of engaging men and boys, just as a one-liner, one sentence that you can share with everyone, just to bring us together so that we can go into the question and answer session. So what is the importance of engaging men and boys in as allies in to sexual and reproductive health and rights? So we'll just have Ontla and then Harriet and then back to Amon and then Nondo, and also just to acknowledge that we had also planned to have a presentation from Francophone Africa. So maybe just a word after Nondo goes in from Linda, and then we can move forward to the question and answer session. So maybe back to you, Ontla. What would you say is the importance of engaging men and boys in this crucial work?
Thank you very much, Mageda. So we feel that it's very important to engage men and boys because, first of all, sexual reproductive health and rights issues are all issues of everybody, men, boys, women, and girls. So it's very important that they also just help with conveying the message and also raising awareness on the importance of allowing girls, women to enjoy their reproductive health rights.
Thank you for that, Harriet. Maybe, do we have Ontla? Okay, can we go to Amon, please?
All right, thank you so much, Mageda. The question one more time. Can you do the question for me one more time?
In reference to the work we've been able to do the past year in terms of engaging men and boys as allies for access to sexual and reproductive health, from yourself, what would you say is the importance? If you were to share at least a one-liner to someone who's thinking about starting a project on this or leading into this direction, what would you say is the importance of engaging men and boys as allies?
Me, I would say we are engaging men and boys because they are part of the problem. I wouldn't want to say they are the problem, but they are part of the problem. We make babies together, so we should be at the forefront of ensuring that the sexual and reproductive health of the persons with whom we make the babies, we are also part of it. And we are living in an Africa where people believe, in my tradition in Uganda, there's a saying that whatever the man says, the woman does. So we are in a society whereby there is that belief of listening to the men. But of course, I keep asking them, can't we listen to the women as well? It's her body, so she needs to make the choices about her body. So by bringing the men on, we are actually ensuring that we are not only part of the process of making the babies, but we're also part of the process of ensuring that that body, their bodily autonomy of the women, their rights are actually upheld. I would put it that way.
Thank you for that, Amon. Maybe to you, Nondo?
Yes. Thank you very much, Mageda, for this question. But I think Amon has already grabbed my, what was really going in my head. The reason why we need really to engage men is that there is a man behind any unwanted pregnancy. There is a man behind any unsafe abortion. But when it comes to bear the consequences, we are throwing the issue to women and pointing fingers to them like they are irresponsible. So I think it's really important to engage them so that they can also play the responsibility in bearing the consequences of any sexual and reproductive health issues. I think that would be my answer.
Thank you for that, Nondo. Do we have Linda Cavera, who can just also give us her views on the final question before we go to the Q&A.
And Linda, you can speak in French. I trust that Nondo will help us translate.
Linda, je pense qu'il y a une question qui vous est lancée. Mageda a fini par une question de savoir pourquoi est-il important d'impliquer les hommes et les garçons dans les dossiers de la santé sexuelle et reproductive.
Merci beaucoup pour la question. Bonjour tout le monde. Merci beaucoup pour cette opportunité. Pour la question de savoir... Allez-y.
Okay. Linda was just thanking everyone for being with us, and she was also thanking us. I mean, the organizers for the opportunity to say something for this opportunity.
Merci. Pour la question de savoir pourquoi nous devons impliquer les hommes et les garçons, et que principalement, tous les hommes ont été profondément affectés par la violence et les maltraitances. Donc, ils ont été, par la plupart des violences sont faites par ces hommes, malgré qu'ils ont aussi été affectés par cela. Ils ont une grande part de prise de décision. L'homme est le chef par la plupart des cas. Il est aussi le chef de famille. Aussi, il est bien positionné dans la société. Il joue un grand rôle important dans l'élimination de la violence au sein de nos familles, de nos communautés, dans le monde entier. Et l'homme est naturellement aimable, c'est-à-dire il est bon. Mais seulement que nos perceptions, les normes sociales, culturelles qui sont en train de peut-être l'affecter, et en fait, il devient aussi d'une part acteur, victime et auteur, parce que cela pousse que nous devons l'impliquer d'une façon ou d'une autre dans la promotion de la femme, parce que les organisations qui œuvrent pour la promotion de la femme à écarter l'homme sans l'impliquer dans la lutte, et cela fait que la persistance de violations, de conséquences que l'on est en train de vouloir éliminer et combattre persiste. Et on sent l'importance qui est vraiment inévitable de l'impliquer, et surtout qu'on ne peut pas agir avec les hommes sans faire participer. On ne peut pas agir avec les femmes sans faire participer les hommes, car ces actions-là seront toujours vouées à l'échec.
Okay, Linda is saying that we should involve men and boys because we are all affected by the consequences of non-access to SRHR of women, the consequences of non-access to SRHR services by women. And also, we need really to involve men because in our society, men play a very big role and in different spaces. From the family level, they are the one who lead or who take the lead of the family, and they are in all the decision-making institutions, and unfortunately, they are also the perpetrator of violence against women. So I think it's also fair if they would play the same leading role in trying to support women, to access SRH services and to end violence against women. I think that's what Linda said with regard to the question.
Oui, mais aussi, nous devons l'impliquer par...
Thank you for that response, Linda.
Okay.
Great. So thank you so much, panelists, for the response to that question. So now just to go to the chat box, we have very many questions on the presentations we had, a couple of them, and I think just going through them, I can be able to just see some that came immediately after the presentations. So we had one much earlier on from Titus Sinyangwe. I think this was around the time Amon had his presentation, and also Nondo, around Nondo's presentation. And the question was on, he said, Titus said, sorry, great presentation, but one question is looking at the large number of women who are not educated and have challenges to read and write. Is there any better way of passing information easily so that no one is left? So maybe I can hand over that to Amon, and maybe Nondo can also add on to it.
All right, thank you so much. A quick one. The issue is that, yes, there are many women who cannot read and write, but when you look at it on the whole, it's not the problem. The problem is that these women who cannot read and write, when they go to the health providers talk to them in the local languages and they get it. And the women want to access the services, but they cannot access the services because the men at home, the system in which the women and the men and the girls have grown in has groomed them not to do certain things. They have stigma of accessing the services. So the issue basically is not that they cannot read and write. Yes, they may not be able to do that, but there is a bigger issue. Which bigger issue is the self-stigma? Which bigger issue is the stigma that is attached to the health service that they want to access? So me, I'll go for address the bigger issue, which is the stigma that is attached. And these women, we can use a number of other tactics that we can reach out them. Maybe Harriet can allude to this. They can share what they have been using in their areas. But I would say, I would first of all go for the bigger fish, which is stigma and discrimination. And once that is away, this woman should be able to go out and look for this information, and they will ask for what the information stands for.
Thank you for that, Amon. Do you have anything to add on, Nondo?
Yes. Thank you very much, Mageda and Amon, for, especially Amon, for the answer you have given. But on top of what Amon said, I think the information or the messages which are contained in the different materials that we jointly developed is really easy to use and can be, as I said, can be adapted to different contexts and translated in different language. But also, we can pick those messages and material and use them in our face-to-face sessions, and use the power of math, the month-to-month session to let those women who do not know how to read to know how it's really important to support women or just to access SRHR services, because this will lead to the gender equality. So I will say that it's up to us in this session to see how we can still use the information and adapt it to our context and use the strategy we always use. I know we have a variety of strategy we use to reach those people. We are working with them. We know how to reach them. So let's use the information, the materials, and bring it to those women who are illiterate and who didn't have a chance to go to school.
Okay, thank you for that, Nondo. Yes, I think I can also hand it over to Harriet, because I remember her talking about dialogue and the importance of dialogue. And so maybe over to you, Harriet, as well. How can we engage girls and women who do not have the ability to read material that is written down?
Okay, thank you very much, Mageda. One of the strategies, and provision of IEC materials in local languages. So in all of our target districts, we look at the predominant language, because Zambia has over 70 languages. So we look at the predominant language in that district or province and use language that we know everybody will be able to reach as many women and girls as possible. I think for us, that's a way forward so far, using local languages.
Okay, great. Yes, thank you for that response. Yeah, and I think in some parts also dialogue, just conversations and talking to the audience, especially at community level, one-on-one, most times enables the conversation to happen without having someone to go back and read materials and writing. On to the next question. The next question is from Nana Zulu. And this question is on, so Nana Zulu says, I am interested in seeing how the engagement of boys will reinforce women and girls' bodily autonomy, as some of the cases involve men and boys coercing women and girls to abortion, and usually done unsafely. Also, Nana adds, thank you all to all the panelists for insightful presentation. So I don't know if we still have Ontla on, and if you could address this question.
Thank you very much for the question, Nana. I'm trying to reach for something in the office that could show how we attend to issues of body.
We lost you, Ontla. The sound.
Yeah. I think we. Okay.
I was saying, to directly answer the question on bodily autonomy, we have collaborated with a local cartoon developer or artist here in the country to come up with booklets that are child friendly. So we have this booklet. The title there is written in our local language, which says, it translates to "This is my body." So in this booklet, we have the different experiences that young children go through as they explore their bodies and how these different issues, such as not allowing people to be dominant over them and stuff like that. So this booklet has been distributed issues of body autonomy from age, and when they get into teenage years, we implement peer education programs in schools to ensure that we talk about issues around sexuality education in a language that they would be able to understand. So we make sure that we start with them while they're still young, so that when they turn into young men, then they're able to know issues of bodily autonomy. Thank you.
Oh, great. So thank you so much for that.
Yes, I can add something on Nana's question.
Sure.
And on top of what Ontla has said. Yeah, I think it will take long, as it is a process of changing people's people's behavior and perception and attitudes. But I still believe that the change can happen, and men can still support women. One of the experience of a project we implemented with our local partners in Tanzania shows that sometimes we accuse those men and boys for not supporting women just because we don't really know if they know what we want them to know. Sorry, what I'm trying to say is that most of boys and men don't really have the correct information on the importance of, for example, of contraceptives, or the importance, for example, of menstruation and menstrual pads. But in that project, we involved young boys and young girls to work together around supporting access to SRHR of young women. And those young people, created clubs in schools whereby they were okay. We trained them, and after imparting them with the skills, they went into their community, and in their schools they created clubs where they were discussing these issues. And we were really surprised to see young boys who are really are taking the lead in agreeing or in just convincing the community on the importance of allocating a family budget to support women's menstruation, because these are the issues that have not been talked about at the family level. And most of the time men don't really realize that women or just girls need, for example, menstruation pad. And in most of the family, there is no any kind of budget which is really being allocated to those young women. So they need to fight themselves and find those commodities elsewhere. So the young people in this project were trying to, to conduct those dialogues with the family members, with the parents, so that parents can understand the necessity of allocating a small family budget to support young girls' menstruation. So I think if those young men has the information, the correct information, and understand why it's important to support women, I do believe that the change will happen. It may take long, but it will happen.
Great. Thank you for that response, Nondo. Just to say that I think Harriet has also something to add on to Nana's question.
Thank you very much, Mageda. Just to respond to Nana, from our perspective, whenever we're having dialogue sessions or call-in radio programs, mostly dialogue sessions, we also look at positive masculinity and just doing away with toxic masculinity. And this is a topic which encompasses bodily autonomy of the female. And also just diving into the policies and laws that we have specifically that look at the rights, the sexual reproductive health rights, and bodily autonomy is actually one of them. But then specifically, we do look at toxic masculinity issues during our interventions with men and boys to just ensure that the issue of bodily autonomy is addressed, because for sure, that is one issue that has perpetuated illegal and unsafe abortions in Zambia, and I think in the African continent. Thank you.
Great. Thank you so much for that, Harriet. I wouldn't have said it much better. I think I remember during our online workshops to develop the SPCC strategy, one of the key pointers we talked about was ensuring everyone understands what bodily autonomy is. And once an individual makes a decision, when the individual makes a decision about themselves, then that is paramount. So even as we engage with men and boys, the understanding of what bodily autonomy is was one of the key issues, and it's also one of the key issues addressed in the SPCC strategy. Okay, thank you for that. So coming to the next question, we have Molefe Cooper, who is saying, thanks to all the presenters for informative presentations. My question is on the experiences of engaging men and boys in sexuality education on their own right as men for their own health, and not necessarily linked or defined from the perspective of women's health. Any panelists who would respond to this question? You can just take the floor.
Maybe I can say something, Mageda. So our work at the moment is around access to safe abortion, and the interventions have been, just around that. But then some of the discussions I remember in the dialogue sessions, especially, young men were that if you impregnate a woman or a girl and you force her or you talk her into an abortion, and because there are certain regulations in Zambia, for instance, very much like that of Botswana, the most convenient way usually is illegal abortion. So once the lady goes into an illegal abortion and it's unsafe and she gets all the complications, even the men or the boys' health generally gets to deteriorate because they'll need to provide for this child. And usually the cases are that these are young men who are not exactly financially stable. So that I think is the point that the perspective, at least from our end, on how we've been able to just handle the men's health from the men's health perspective.
Yeah, I can also add something on what Harriet said. We are trying to look at the inequality in achieving, in achieving sexual and reproductive right for all, and also try to achieve gender equality. But in our presentations, we said that the harmful social norms amplify the inequalities between men and women. And this is, okay, I just want to bring this so that you can understand that we are working from that perspective. We feel like there are a lot of inequality. The social norms gives men the big power to control the sexuality of young people, of women. So we are trying to engage men and boys to, to address those inequalities which are supported by the social norms. So yeah, I agree with you that maybe we should be providing comprehensive sexuality education to boys, which we do, of course, to boys, not necessarily from the women perspective, but to do this, I think it would be also good if men could have that kind of movement between themselves to educate themselves about about their responsibility over women in terms of sexuality and the reproduction. I think that can work better. But from what we were working on, we were working from that background which I gave. There are inequality which are sustained and supported by the by the harmful traditional norms. So we are trying to to ensure that men understand their role and their responsibility in supporting women to access sexual and reproductive health services.
Great. Thank you so much for that addition, Nondo. I think that really goes to show that, yes, we are working from that perspective. And I think the basis is from that perspective, but there's also no harm in having more information out there for everyone to receive information on their sexual reproductive health and their health also in particular. So just moving on swiftly, we have a few more questions to go if you'd bear with us, and then we can be able to close off. But we have one or two questions from the participants. So from Chupa Kabaso, Chupa is talking about culture and religion. So Chupa says, SRHR is under attack every day, largely due to culture and religion. How can we work to end this? We talk of involving gatekeepers such as traditional and religious leaders. How successful has that intervention proved to be? That's the question from Chupa. If I could invite Ontla to address this. I think Ontla spoke about engaging with religious leaders, and maybe if Amon can also pick up afterwards after Ontla says one or two. Okay, I don't think we have Ontla. Amon?
All right, thank you so much, Mageda. Let me just get to the question one more time. And you're talking about
religious leaders. and engaging culture and religious leaders. And the fact that we talk about engaging gatekeepers all of the time. Is there an intervention that you've heard of or you've been able to work on that shows that this is possible, that this can be successful?
Yeah, it's possible. I remember way back, I think 10 years ago, we had an intervention in Uganda by the Communication for Development Foundation Uganda. It was called the Young, Empowered and Healthy. They had a project called Be a Man, which later rebranded into True Manhood, was working on addressing masculinities that put young men at risk of HIV. And with this, we worked with a number of gatekeepers, cultural leaders, religious leaders, whom we engaged in understanding the different masculinities that increase risk of these young people towards HIV. And research that were made showed that actually young men who had interacted with the different religious leaders had promised, their behaviors had actually changed from what they were before the project than after they had interacted with the religious leaders. The issue here is that religious leaders, people look at them as God, and anything that they say, people will believe in them. Other gatekeepers like cultural leaders whom we worked with and other opinion leaders like aunties in Uganda have had a strong impact on the behaviors of the men and the women, especially around issues of sexual and reproductive health. So yes, they can work, and they have worked, at least on that particular one. The Young, Empowered and Health Initiative, the True Manhood campaign, someone can Google about it. It really worked.
Great. Thank you for that, Amon. Yeah, also, I think I'd just like to add on that. I think the biggest challenge is also when you're engaging religious leaders and traditional leaders, something we talked about during this partnership, is how you craft the messaging around them and also realize what is important to them. And also when you're addressing them, what the communication is. Sometimes we go to them with statistics and maybe that's not their concern, but rather looking at it from a human rights perspective or a human perspective. So how you engage with religious leaders would be totally different with how maybe you engage with policy makers, but also creating those inroads would be like the first step, and ensuring your safety, but also finding a safe space whereby these conversations can be had, and sometimes also starting back. So the tactics are usually a bit different as compared maybe to other conversations, community conversations. So for any project that would like to program or intervention that would like to use that, definitely the ways to go about it would be different. And we'd be able to share the SBCC strategy, but some of those learnings and how to do that are some of the things we're able to address as MenEngage Changemakers Africa and Women Global Network. So I think we're about to come to a close. I would just like to go to the final question. In the chat box, I also see some comments like, I have seen men blaming women for abortion, yet when a man refuses to acknowledge the pregnancy, it's also an act of abortion, but the society doesn't view that they blame it on a woman. Let's see the change and the biggest role men play in this. And then I think that the final question here is from Frederick. The comment was from Lizzie Nyambura. Thank you, Lizzie, for that comment. And then from Frederick Musonda, in a case where a man and a woman are not legally married but happened to have pregnancy, does it consider a man's consent to do safe abortion? So this question is from Frederick Musonda. I'll hand it over to Harriet, but just before she picks it up, I would say that in terms of policy, when you say, does it consider a man's consent to do a safe abortion? I think policies are different with different countries, but I can just throw it to Harriet to tackle that question. And then.
Thank you very much, Mageda. So with regards to consent, I think this is something that Nana had actually also brought up. Consent is not necessarily support. Well, we never get an abortion doesn't require consent from the man. That's for starters. And also just looking at our policy, for instance, the termination of abortion or pregnancy rather in Zambia, it states basically if the woman poses a risk, whether it's mentally or physically, or it's the pregnancy is going to harm the already existing children physically or mentally. So really about consent, it's on the woman. So the important thing I think to take away or to understand is that men need to support women's access to safe abortions, and also just help with doing or dismantling negative social norms that perpetuate name shaming and the stigma that abortions or termination of pregnancies have. I think that would be my answer. Thank you, Mageda.
Thank you for that, Harriet. So we are leading up to the close. Maybe if you have any closing remarks from Nondo.
No, actually, I will just say something on what Harriet has already addressed. I think women bear most the burden of a pregnancy, and I feel really bad when men try to interfere with the decision of that woman on something he doesn't know really he doesn't feel the weight of it. So I think the decision should be up to the woman to decide on any abortion, being legally married or not married or not legally married. In any circumstance, for me, I think the decision should be from a woman. The question would be maybe before even the pregnancy, how many people ask themselves when they're going to do sex, how many people ask themselves about the legality of the pregnancy in the termination of the pregnancy in their country? Nobody. But when it comes, the pregnancy is there, it's when we bring in all these kind of the legality and whatever. But my answer would be, let women decide on what really affects them most, especially the pregnancy. That would be left to a woman decision. Yeah, in terms of closing, I would say I would thank everyone for your participation and the engagement we had in this session. I wish we would have another space where we could also talk about some other issues which we have been working on. But yeah, we will try to see, and I think the project is already ending maybe. But I heard like the Ubuntu session will go up to June, so we'll try to find a way to meet you again in the future, and I wish everyone like a pleasant evening. Thank you.
Thank you for that, Nondo. Thank you for your closing remarks. I think the final words we get here is that whatever a woman decides to do with her body, that is her choice, and that choice is paramount, and that is what we need to support. Do we have any closing remarks from Harriet?
Thank you, Mageda. I think I'd just like to thank the participants for the contributions, the questions. I think we never keep learning. I personally always tell people that, learning never comes to an end. So I have definitely learned one or two things from the others. And I really do hope that we have another session, because this conversation, I think, we can do, there's more to tell than what we have actually offloaded today. So I'm looking forward, hopefully, to another session. Thank you.
Thank you so much for that, Harriet. We don't have Ontla in the room, but we'd like to thank Ontla. From the other panelists, I see thanks all from Linda Cavera. I see from Amon saying, I love you guys. We love you too, Amon. And then also in the final comment in the comments from Nicholas Danforth, I can't thank you all panelists enough for all your good hard work, clear and hopeful presentations today. As a consultant for years on the African SRHR and a former director of the organization which won the US Supreme Case legalization abortion Roe versus Wade, I congratulate Amon, Harriet, Nondo, Ontla, Linda, and all of you for your efforts to change men's behavior and policies leading to the other global pandemic of unintended and compulsory pregnancy. Thank you enormously for continuing vital campaign to engage men in support of women's sexual and reproductive rights. Your work is vital for women, men, and the children who deserve to be born when they are planned and loved, ideally by two parents. Thanks all. Thank you guys for your time. So I'd just like to hand over to Magali so that we can be able to close the session. Magali, over to you.
Thank you so much, Mageda. Thank you, all of you. It's been, a fantastic conversation.